We're going to get right to the coronavirus outbreak. As we begin this morning, there are now more than 337,000 cases and nearly 10,000 deaths in the United States. But as we heard from Governor Cuomo, the number of fatalities does appear to be slowing here in New York City. Meantime, stressing the need for strict social distancing in the days ahead, Dr. Anthony Fauci said as many as half of all infected people do not experience symptoms. And just this morning, Japan's prime minister is expected to declare a new state of emergency in Tokyo and several other major cities in the wake of renewed surge of cases there. We have it all covered. We're going to start with NBC's Sam Brock. Hey, Sam, good morning.
Hoda, good morning. When it comes to war on coronavirus, things may be about to go from bad to much worse. The White House warning right now the next 2 weeks are pivotal as the country enters its toughest period yet. With multiple states heading into what experts believe will be make-or-break weeks in the fight against COVID-19, overnight President Trump trying to put a positive spin on an escalating situation.
We're starting to see light at the end of the tunnel.
But just 24 hours earlier, the president admitting
There'll be a lot of death, unfortunately.
An assessment echoed by his top health advisors.
The next week is going to be our Pearl Harbor moment. It's going to be our 9/11 moment.
The president also doubling down on his calls to use the anti-malaria drug hydroxychloroquine, even though there's no evidence it's effective against COVID-19.
What do you have to lose? They say take it. I'm not looking at it one way or the other, but we want to get out of this. If it does work, it would be a shame if we didn't do it early.
Weighing in when Dr. Fauci of the coronavirus task force was later asked about the drug.
And would you also weigh in on this issue of hydroxychloroquine? What do you think about this, and what is the medical evidence?
That question?
Yeah. Well,
Maybe 15 times.
Alarming new projections point to peaks in New York, Detroit, and New Orleans in a matter of days. With a deficit of supplies, governors in many states are scrambling to prepare. Michigan has more than 14,000 cases of the virus, third most of any state.
It's growing exponentially, and we're seeing that it doesn't discriminate based on city line, state line, party line.
New Orleans has the country's most lethal death rate, while more than 4,000 have now died in New York. 9 states are still refusing to enact full stay-at-home orders, including Iowa.
If additional action is necessary to protect the health and safety of Iowans, I will do so.
But the Surgeon General saying it is vital to stop the spread.
Give us a week or two if you can. We want you to do it for 30 days, but even in those 9 states, give us what you can so we can get this peak and start to come down on the other side.
In California, Riverside County is mandating all 2.5 million of its residents wear masks when they leave the house, one of the strictest measures in the country. On Sunday, many turning to their faith, but some ignoring the science of social distancing. In Louisiana, one church holding their usual Sunday Mass, led by Pastor Tony Spell, who was arrested last month for holding services despite a ban on large gatherings.
They would rather come to church and worship like free people than they had live like prisoners in their homes.
Here in Florida, the governor drawing heavy criticism for saying he doesn't have the authority to close houses of worship, but of the 15 states with the most vulnerable populations to this disease, 11 of them, mainly in the South, have religious exemptions. Savannah, back to you.
All right, Sam Brock, thank you very much. And as we begin a new week, the mayor of New York City is warning hospitals there could run out of ventilators in the next 2 days. But as mentioned, there is some hopeful news in the fight against the virus in New York. NBC's Gabe Gutierrez is at the makeshift hospital set up inside the Javits Convention Center in Manhattan. Gabe, good morning to you.
Savannah, good morning. The Javits Center behind me now has 2,500 beds, making it the largest hospital in the country right now. The U.S. military personnel are staffing it. The federal government sending 1,000 doctors, nurses, and respiratory techs to handle the overwhelming need here. And we should warn you, some of the images you're about to see are disturbing. This morning, the U.S. military is on the move, deploying staff to 11 New York hospitals as the city enters what's expected to be its most critical week yet in the battle against coronavirus.
The system is over capacity.
At one hospital in Brooklyn, an unsettling scene. Body bags lining a hallway until they can be moved outside to temporary morgues. Still, a possible glimmer of hope.
The number of deaths over the past few days has been dropping for the first time. What is the significance of that? It's too early to tell.
New hospitalizations, along with ICU admissions and intubations, have also gone down in New York, but the overall death toll remains grim. The state topping a staggering 4,100 deaths and more than 122,000 confirmed cases.
I hope we're somewhere near the apex, right?
A healthcare system already pushed to its limits is now preparing for the worst.
None of us actually expected anything like this to ever happen. We only know to do one thing, and that's to show up at work and to take care of our patients.
The state's urgent plea for help and supplies has been answered by those near and far. Nurses with Samaritan's Purse who have responded to disasters around the world, now helping at the emergency field hospital in iconic Central Park.
We have never been responding together in America to a disaster situation, so this is a first for us.
China sending 1,000 ventilators, another 140 from Oregon. In neighboring New Jersey, a new field hospital is opening today as the state surpasses 37,000 cases and quickly approaches 1,000 deaths. Among the lives lost, Richard Gould, the former fire commissioner in Woodbridge, New Jersey. He was honored by the department, which held a funeral processional through town. 65-year-old Priscilla Caro was a coordinating manager at Elmhurst Hospital in Queens. The world also lost jazz legend Wallace Roney, a renowned trumpet player who learned from Miles Davis. He was just 59 years old. New York Mayor Bill de Blasio estimates the city will need an extra 45,000 medical workers to match expanding hospital capacity throughout the area. Hoda.
All right, Gabe, thank you so much. Let's turn now to our medical correspondent, Dr. John Torres, and NBC News contributor, Dr. Joseph Fair. He's an expert on the study of viruses who was on the front lines of the African Ebola crisis. Good morning, doctors. I'm going to start with you, Dr. Fair. We keep seeing what the Surgeon General was saying. This is going to be our Pearl Harbor, our 9/11. This week is critical. What do you think we should be prepared for in this week, Dr. Fair?
I think I would agree with his statement, only it's just going to be nationwide and not localized, to a certain area. We all felt it as Americans, but when it directly touches you, when it's someone directly related to you or a colleague, obviously it's going to touch you in a different way. And so I think he's trying to prepare the nation for what that's going to look like. Having been through my fair share of these outbreaks and things like this and seen a lot of these deaths occur, it is something that you do have to prepare for mentally. And it's not going to be easy to get through, to be honest. So I think as a nation, he's making that reference just so, to best prepare people as best he can as a nation to get ready to go through that grieving process that is unique to outbreaks.
Well, there was a little bit of sound that was played at the president's coronavirus task force meeting yesterday. It was from Dr. Deborah Birx, and it struck us because it had to do with the everyday things we do, and she now says maybe we shouldn't be doing them anymore. Take a listen.
This is the moment to not be going to the grocery store, not going to the pharmacy, but doing everything you can to keep your family and your friends safe. And that means everybody doing the 6 feet distancing, washing your hands.
Not going to the grocery store and not going to the pharmacy, Dr. Fair. Why now?
She's really just talking about absolutely minimizing our interaction with one another. And, those are essential tasks. We're going to have to do them occasionally. But I think what Dr. Birx is trying to get across, and by the way, I have really strong faith and confidence in both her and Dr. Fauci. They do know what they're doing. But really trying to minimize in any way, form, or possible that human interaction with one another that's going to lead to us breaking that social distancing protocol that we're trying to implement across the country, nationwide, across, really everywhere in the world that we're trying to do at the same time. It's harder as we have more and more people on Earth, and in urbanly and densely populated places like New York, it's even harder just because we live much closer to one another. But that's what we're trying to do.
Dr. Torres, in Gabe's piece, the New York governor did have, it sounded like a little bit of good news. He said the numbers have been dropping. On Saturday, the number of deaths was 630. On Sunday, it was 594 in New York. What are we to read into those numbers? Have we reached the apex, do you think?
And Hoda, I think what you're seeing there is exactly what should be said, is there is a glimmer of hope here. We're seeing some light at the end of the tunnel, but you can't base these decisions that they're making on hopes and promises and wishes. You have to base them on good data-driven projections, and projections are showing this is going to be a bad week, and he knows that. So he's not willing to say yet we're at the apex, and nobody is, because we still have to wait to see what happens as we start getting up that curve and finally coming down the backside of that curve. We might be there, we might not, but again, you can't base any of your decisions on the hope that we're there. You have to base them on the fact that we know more patients are going to come in. We're going to still have more shortages. We're still going to have more issues going on here, especially in New York City. But other cities can use this as an example and template of what's happening to them as time comes on and they start looking at their own curves start increasing and their own cases starting to inundate their hospital systems.
Let's talk about it. This is the most critical week. This is the week that we have to have all hands on deck. This is the week we need all of the equipment, Dr. Torres. How are we doing in that department during this week?
Well, Hoda, I think we're doing better than if you'd asked that question 2 weeks ago or maybe even a week ago, but I don't think we're still at the point yet where we can handle everything that's going to be happening here, especially if the week is going to be as bad as projected. There are going to be some shortages, and I can tell you as a doctor, when you start having those shortages and you have to make those decisions, that's the toughest decision in your career to make on who gets treatment, who doesn't get treatment, and this is things I've done in different environments, military, civilian field, not something you want to have to make, and so hopefully more and more equipment comes in. We're hearing about China, Oregon, Washington State sending ventilators here, the National Guard going to upstate New York to get ventilators to bring them down to New York City. I think we're doing the things we need to do to get those ventilators moved around, which are the crucial piece of equipment we need, but there are other shortages as well still we're working on. Those shortages will be resolved, but how quickly they'll be resolved and how much of an impact they'll have in the meanwhile is going to be the critical thing on saving lives going forward here.
All right, Dr. Torres, Dr. Fair, thank you so much for your time. We appreciate it. Savannah, over to you.
Well, now, Hoda, to those new developments tied to the coronavirus outbreak aboard the USS Theodore Roosevelt. The ship's captain was relieved of command after he wrote a letter begging for help for his crew. And now he himself has reportedly tested positive for the virus. NBC's White House correspondent Kristen Walker has been following this story for us. Kristen, good morning.
Hi, Savannah. Good morning to you. It is the latest twist in this ongoing controversy facing the U.S. Navy. Captain Brett Crozier has reportedly tested positive for COVID-19 just days after he was dismissed for writing that widely circulated letter, sounding the alarm about an outbreak of the virus on his ship. Crozier is now in quarantine as fallout from his firing mounts.
Captain Crozier!
For Captain Brett Crozier, it was a hero's farewell. Now, word that he too has tested positive for COVID-19. The news comes after videos began surfacing of clapping and cheering sailors aboard the USS Theodore Roosevelt, saying goodbye to Crozier, following his removal from command Thursday, in response to his warning that action was needed to save the lives of his crew from a coronavirus outbreak. 2 Naval Academy classmates of Crozier who remain close to the family revealing the diagnosis to the New York Times on Sunday. The classmates telling the Times Crozier began showing symptoms of the disease before he was fired on Thursday. The Navy's top brass dismissing Crozier from his duties aboard the USS Roosevelt just days after the commanding officer penned a blunt letter to Navy leaders calling for stronger action to address the COVID-19 outbreak aboard the aircraft carrier, writing, "We are not at war. Sailors do not need to die." The Navy's acting secretary explaining the decision last week.
I have no doubt in my mind that Captain Crozier did what he thought was in the best interest of the safety and well-being of his crew. Unfortunately, it did the opposite. It unnecessarily raised alarms with the families of our sailors and Marines with no plan to address those concerns.
The move to dismiss Crozier setting off a firestorm. Presidential candidate Joe Biden responding on Sunday.
I think it's close to criminal the way they're dealing with this guy. I think the guy should have a commendation rather than be fired.
Now, for his part, President Trump is defending the dismissal, saying Crozier's letter asking for help for sick crew members was, quote, not appropriate. As for Crozier's condition, Navy officials would not confirm whether he's tested positive for the virus. A defense official telling NBC News, though, that once Crozier left the Roosevelt, he went into quarantine on Naval Base Guam and that he will remain there for 14 days before being reassigned. Savannah.
All right, Kristen Welker at the White House for us. Thank you. Hoda, 717, over to you.
Oh, that means it's time for a check of the weather as we start this new week. Al joins us from home with some details. Hey, Al.
Hey, good morning, Hoda. Good to see you. Unfortunately, we don't have a lot of great news to talk about for our friends in the Midwest and the Central Plains. We are looking right now, 13 million people at risk for tomorrow, for damaging winds, tornadoes possible, and large hail. And then as we move into Wednesday, it moves south and east from Memphis all the way to Knoxville, Nashville, just to the south of Evansville. As this system pushes east, mild air will surge northward. Storms will develop at night tonight in the Ohio River Valley, which is really one of the most dangerous times. Tomorrow, showers and storms move rapidly to the east, a flood threat for Ohio and West Virginia, and we're also looking at a second line of storms that'll come in later this week, which may bring more wet weather for the Northeast and parts of the Midwest as well. Southeast going to be looking very nice. We'll be looking out west as stormy as it is. We'll do that in the next half hour.